The stages of labor. There are 3 distinct stages that can help describe the process of labor. Understanding the stages of labor can help you prepare for the arrival of your baby and make informed decisions about your childbirth experience. First stage of labor. The first stage of labor is divided into 3 phases: early labor, active labor, and transition. Early labor, also known as the latent phase. During this phase, the cervix starts to soften, thin out, and open up. Contractions during this phase are mild, irregular, and can last from 30 to 60 seconds, occurring every 5 to 20 minutes. The cervix typically dilates to about 3 to 4 centimeters during this phase, and it can last anywhere from a few hours to a few days. Active labor. This is the second phase of the first stage of labor, and it's when contractions become stronger, more frequent, and more regular. During active labor, the cervix continues to dilate from about 4 to 10 centimeters. Contractions during this phase last longer, about 60 seconds, and occur every 3 to 5 minutes. This phase can last from a few hours to about 8 hours for first-time mothers. Transition. This is the final phase of the first stage of labor, and it's when the cervix finishes dilating to 10 centimeters. This phase can be the most intense and challenging for women, as contractions are very strong and close together, lasting up to 90 seconds and occurring every 2 to 3 minutes. Some women may feel shaky, nauseous, or overwhelmed during this phase. Transition typically lasts from 30 minutes to 2 hours. It's important to note that these phases are not rigid and can overlap or progress differently for each woman. Some women may experience a shorter or longer first stage of labor, and the timing and intensity of contractions can vary. Your healthcare provider will monitor your progress throughout labor and provide support and guidance to help you manage pain and ensure a safe and healthy delivery. How long can the first stage of labor last? The first stage of labor is the longest stage and can last for 12 hours if you are having your first baby, and about 8 hours if you have given birth before. However, exact times will vary significantly between each labor. When should I go to the hospital or birthing center? If your pregnancy has been normal and without complications, it's recommended to head to your hospital when you're experiencing contractions every 3 to 5 minutes. Typically, at this stage, your cervix will be dilated between 4 to 6 centimeters. A simple rule for when to go to the hospital for labor is the 5-1-1 rule. You may be in active labor if your contractions happen at least every 5 minutes, last for 1 minute each, and have been happening consistently for at least 1 hour. Additionally, if your water breaks, you notice bright red blood from your vagina, or there is a change in your baby's movement pattern, it's essential to call or go to your hospital or birthing center immediately. If you had planned a cesarean birth, but you go into labor before the scheduled surgery date, it's also important to head to the hospital. Second stage of labor. It begins when your cervix is dilated to 10 centimeters. Your midwife may check how dilated your cervix is by doing an internal examination. You may not feel an urge to push straight away. This is called the passive second stage. It becomes the active second stage when you have the urge to push and ends when your baby is born. Your contractions will be longer and more powerful than they were during first stage of labor, but they may also be slightly most spaced out. This gives your body time to rest. Each contraction pushes your baby's head further down your pelvis, slowly edging the baby closer to being born. You may feel an urge to push to help your baby be born. How long can the second stage last? The second stage of labor typically lasts between 20 minutes to 2 hours for women who have given birth before, and up to 3 hours or more for first-time mothers. However, the length of the second stage can vary depending on a variety of factors such as the position of the baby, the mother's health, and the type of delivery. What happens as my baby is being born? At the end of the second stage of labor, your baby is born. Your midwife will check that the baby does not need any immediate medical care. Then they will give you your baby to hold and cuddle. This is known as skin-to-skin contact. This helps to create a bond between you and your baby. You will have the opportunity to breastfeed your baby if you would like. Your midwife will stay close by in the first hour to make sure everything is okay. Third stage of labor. It begins when your baby is born. During this stage, the placenta and membranes that supported your baby in your uterus come out through your vagina. Your midwife can help this to happen by guiding the placenta out and by giving you an injection to help your uterus contract. This is called active management. Some women prefer to deliver their placenta without medical help. It is a good idea to discuss your preferences with your healthcare team during your pregnancy and before the birth. During the third stage of labor, the umbilical cord, which connected your baby to your placenta, is clamped and cut. If you would like the umbilical cord to be left intact, or to be clamped later, you should let your midwife know so that they can arrange this. If your birth partner would like to cut the cord, let your midwife know. The third stage of labor generally lasts about 30 minutes. After your placenta has come out, your midwife will check if you have a tear and if so, how deep the tearing is and where it is located. Small, shallow tears may not need to be closed with stitches. However, larger tears should be treated to make sure that they heal properly.